Kia ora mai tata katoa, ko Merle Lahau. Hi everyone, my name is Merle. I have a number of long-term conditions, including high blood pressure, high cholesterol, and arthritis in my knees. If you have long-term conditions like me, you know you really need to look after yourself. We only spend a few hours a year with our health professionals, so the rest of the time it's up to us to look after ourselves. You know, health professionals call this self-management. I call it, hei whakatika te tinana, looking after myself. Researchers are saying if you're good at self-management, you do these things. Be actively involved with your GP and other health professionals. Follow the care plan you have agreed to monitor your symptoms and respond to them, that you can manage the physical, emotional and the social impacts of your condition, that you live a healthy lifestyle, and that you have access to support services as you need them. Do you know about your long-term conditions? Everything you learn will make a difference. You can ask your doctor, nurse and other health professionals about them. Here are some useful questions that you could ask. So what is my main problem? What do I need to do about it? And why is it important for me to do that? Also, what other things can I do to help stop my long-term condition getting worse? You can also find out more from New Zealand websites such as Health Navigator, Heart Foundation, Arthritis New Zealand, Diabetes New Zealand, and also Kidney Health New Zealand. Some people have to keep monitoring what is going on with their health. If you have diabetes, you may need to check and record your blood sugar level, or if you have heart failure, you'll have to weigh yourself each day and also record your weight. Some people like to keep their records in a special book called a log book. If you are monitoring a whole lot of things such as weight, blood sugar level and blood pressure, you might like to keep all this information in a notebook. You could also add your appointments, other symptoms and questions that you may have for the next appointment. If you want to get better at self-management, then you need to have a care plan. Do you have one? A care plan is a written document that you've agreed with your health professionals. So the care plan will cover things like what's important to you, he aha te mea nui, what you want to achieve, and these are your goals, how you're going to achieve your goals, and who's going to help you achieve them. Your care plan can change when you achieve your goals or if your condition gets better or worse. If you don't have a care plan, ask your doctor or nurse. Look, you are probably going to need a double appointment with the nurse to write one. To prepare for this, think about what it is that's important to you and the goals that you want to achieve. Prepare before you go to your appointment. Remember, a care plan isn't about what the doctors and the nurses want you to do, but it's about what's important to you and what you want to do. There are lots of other things that we can do to look after ourselves. Health professionals call these lifestyle or behaviour changes. Making changes can be hard. You need to find a thing that will motivate you to make the change. That's why you need to think about what is it that's important to you. And you can start by changing something small, something that you do every day. Small changes can build on each other. Sometimes a big change can just be too much. Do you know there are support services or allowances that could help you? Ask your health professional about what groups are available in your community. I go to an arthritis group and also a Hei Mahi Korowai group. One of the things you can go to is a self-management program. These programs are for people with all sorts of long-term conditions, and they run for 6 weeks for about 2.5 hours per week. Ask your health professional to refer you to a program in your area. Remember, self-management is about looking after yourself and what's important to you. So you're the expert in your long-term condition because you're the one that lives with it every day. Your health professionals are also experts, so working in partnership with them is the best way to manage your long-term condition. Remember, for more health information, you can go to healthnavigator.org.nz. Kia ora mai tata katoa, mō koutou hei whakarongo hei titiro hoki. Kia ora.